Hello everyone, I am Dr. Balakumar, Senior Consultant Vascular Surgeon. This month, September, we are celebrating the Peripheral Arterial Disease Awareness Month. So what do you mean by peripheral arterial disease? So the arteries which supply the upper limb, hand or the lower limb and the legs and the abdomen, and also the arteries which supply the brain through the neck. These arteries are called peripheral arteries. So who are all the patients who are likely to be affected by the peripheral arterial disease? Any patient who has diabetes for a long time, who has hypertension for a long period of time, who has high cholesterol, who are alcoholics, who are chronic smokers, and obese patients who have very sedentary lifestyle. So these are the patients who are at high risk for having a peripheral arterial disease. So what are the symptoms of peripheral arterial disease? So normally the symptoms of peripheral arterial disease can be characterized into 4 different sets. So many of the patients, like more than 50% of the patients, will be initially asymptomatic. So they fall into the category of asymptomatic patients. The second group of patients are called claudicants. So what do you mean by claudication? Claudication is a pain which a patient can suffer in either in the gluteal region or the buttocks or in the thigh or in the calf muscle or in the foot. So when do they get this pain? This pain occurs only after a period of walking, short distance of walking. The walking distance can be initially 2 kilometers, then they may have a pain. After some period of time, the distance can decrease into 1 kilometer, half a kilometer, or then into few hundred meters also. So when they walk for few hundred meters, they may have pain either in the gluteal region, thigh, calf muscle, or in the foot. So they have to stop for a short period of time, take rest, and then continue with further walking. This is the first category of patients in claudication. Then later on, they may not be able to walk for a short distance, and then they have severe pain in these regions which I mentioned. So this group is called claudicant group. The third group is called critical limb ischemia. So after the patients who have claudication, later on they develop ulcers. These ulcers are initially painless ulcers, but they don't heal for a period of weeks. Any ulcer which doesn't heal for a period of more than 3 weeks, we term as arterial ulcers. So initially they may be painless, but then later on when the blood supply further decreases, they may have chronic pain even at rest time, even when they don't walk. At rest also they have pain, and also it disturbs the sleep, and this pain is called nocturnal pain. So these patients are the patients who are suffering from critical limb ischemia, and if they don't get treated, they are at high risk of losing their limbs. The fourth group set of patients are the patients who have acute onset of symptoms. Now they may be normal the previous day, suddenly on one day they have acute symptoms like pulselessness. The pulses will be absent in the upper limb or the lower limb. They may have severe pain wherein they will not be even able to walk. There will be loss of sensation and loss of motor power. They will not be able to walk because of foot drop. The ankle joints will not be mobile, or if the hand is involved, they may even have a wrist drop. The fourth symptoms is the limbs may be cold. This is in medical terms we call that as poikilothermia. Very cold limbs. And the nail buds may be whitish in color or bluish in color. The skin, if someone is fair in color, we may appreciate the skin becomes very white in color because of loss of blood supply, which we term as pallor. So these are the 4 set of patients who may be having symptoms following a peripheral arterial disease. So what is the reason for us to be aware about peripheral arterial disease? Today we know diabetes is a huge set of patients, huge set of population are affected by diabetes. So any patient who have diabetes, 25% of the diabetic patients are proved to have peripheral arterial disease, and of this 25% patient, another set of 25% of patients are likely to lose their limbs and will end up in amputation. Last year alone, we had about 200,000 amputations in India. So get checked early for onset of peripheral arterial disease, particularly the patients who are at high risk, by meeting a vascular surgeon, and get screened for evidence of decrease in blood supply to prevent further complications and loss of limbs. Thank you.